Good morning and welcome to the Big Story segment here on the BDTV Breakfast Show. This is where we discuss key issues shaping our nation and our economy. My name is Elizabeth Musa, and today we'll be exploring how the health emergency responses and disaster management and the role of stakeholders with a focus on how players in the space can improve in responding early to emergency and the right measures to prevent and manage disaster in order to protect more lives and properties. Of course, we know that thousands of lives and properties worth billions have been lost to disasters and emergencies, and in Nigeria and many other places, some of these emergency cases and disasters could be avoided if the right actions had been taken. Many of the lives lost were also attributed to ignorance on the part of the victims and, of course, the failure of appropriate bodies, including persons tasked with the responsibility to reach out to the victims early enough. Today, we turn our focus on how this situation can better be handled and managed to avoid the continuation of precious lives and properties in our society, the continuation of the death and damages to lives and properties. Now, to understand this better, we are joined by our guest analyst today. We're being joined by Dr. Emmanuel Olowokere. He is the Chief Operations Officer at Citron Health. We're also joined by Mr. Pascal Achunine, is the Director of the Health Emergency Initiative and is also an Ashoka Fellow. And it's interesting and very lovely for you to be joining us this morning. Good morning.
Good morning.
Good morning.
Thank you for having me.
It's a delight to have you on our show today.
It's a pleasure.
Let me start by asking you and going straight to the conversation. Perhaps I should start by asking you to take us through what emergency response and disaster entails precisely, and I would just start by asking you, Mr. Pascal.
So it's very important for everyone to plan. There's a popular saying that when you fail to plan, you plan to fail. And because we do not attach value to lives in Nigeria, human lives, you hear of massive number of deaths. I would try to make it more real for us and pragmatic, less of academic, so that everybody can relate to this and it can resonate. So we, in Health Emergency Initiative, I'm the Executive Director, as earlier introduced, of Health Emergency Initiative. And we started off, I will connect it with part of our journey. We started off paying the hospital bills of indigent patients in public hospitals, those who have non-chronic medical conditions. And based on data, some of them shared by UNICEF and WHO, we realize that 1 out of 5 children do not see their 5th birthday in Nigeria. And the programs we introduce with public hospitals and missionary hospitals focus on ensuring that non-chronic medical conditions are provided. We give immediate support. And we now found that working with Federal Road Safety, we did an assessment and realized that road traffic accident is the biggest killer of young people in Nigeria. So we expanded our program to include payment of hospital bills the first 24 hours, the initial deposit required to get them to stay alive in Nigeria, starting with Lagos, but we are now in 13 states. But over time, we recognize what we just spoke about, that pre-hospital emergencies account for more than 30% deaths in Nigeria. So from 2019, in collaboration with FRSC, and then we introduced other agencies like Lasambos, we started first by training and equipping their personnel, even though they wear the uniform, even though they are statutory required to be at the scene of emergency. But most of them do not have the basic skill. So we started training them, over time we now expanded to those who we call bystanders. Of course, we are all very familiar with taking pictures and videos at the scene of emergency and put on social media, but do nothing. For various reasons, people do not know this, do not have the skill, but also people are afraid of being harassed. So we train those who might even harass. So we expanded to the police, LASMA, VIO, train these ones, but now went to everyday Nigerians, artisans, the likes of vulcanizers, filling station attendants, keke, Uber drivers. These ones have more passion and their risk appetite, desire to be at the scene and to help. And then we went further to introduce it to secondary school level so that young people can embrace the culture of saving lives. So when you talk about emergency responsiveness, our engagement so far, interaction with the society, various segments of the society, shows that maybe if as a producer, if I ask, do you know the emergency numbers in Lagos or Nigeria?
Funny enough, I mean, we know them, but we don't even know them offhand.
Okay, so that knowledge that you can call 767 or 112, and then when it's up country, these two are for Lagos, 122, that can enhance the survival chances of a crash victim by more than 50%. So those are some of the key things we integrated into the training. So we'll call it an integrated strategy, where when an accident happens, when there's a gas explosion, when there's building collapse or even drowning, we have relationship. We signed a MOU with the key hospitals and the FRSC and ambulance service, but also expanded it that these people need training. So we provide support on one hand for payment of initial deposit, but also included that we train people to have this knowledge. And then when we talk about emergency, you mentioned, we are not only limiting it to crash, fire, accident. It could be that people have heart attack, cardiovascular related diseases account for massive number of deaths in Nigeria. People, of course, you've come across or heard of this, what we call the epidemic of people slumping and dying. All of this fit into the ecosystem of emergency response. And so we've taken various proactive steps to change that narrative across Nigeria. We have that footprint now in 13 states in Nigeria.
Dr. Adeola, I know you probably want to make some additions to what Mr. Pascal has said, and if you have that, you can please go ahead.
So thank you very much. It's very imperative that we're having this conversation, as Mr. Pascal has rightly said earlier on, about the stakeholders' engagement. So across the different tiers of government, there's at the level of the federal where policies are made, and these policies are binding. Currently in Lagos State, there's an executive order whereby every resident or every person in Lagos must be signed to the HMO or must have like an affiliation with HMO, which is being spearheaded by Lagos State Health Management Agency. So with that coming into that executive order coming into play, me as a private service provider with a network of 120 ambulances across Nigeria, I don't have to bother with, okay, who gets to pay the bill if I dispatch my ambulance. So I can easily dispatch an ambulance knowing fully well that if I'm signed as an health service provider with Lagos State Health Management Systems, right, I can easily go. So we have the HMO side, the health management organizations that have like the private companies and those people onboarded on them, and which we have like an existing partnership at least with 3 to 4 of those 4 to 5 of those HMOs. AXA, Mansard, Leadway, Avon, what they call it, Anchor, Novo, Redcare, right? So it's very easy for me to say, okay, AXA, Mansard can give me a call, Avon can give me a call, oh, dispatch this ambulance. I've had like movement in the night whereby we had to move someone from an accident scene, just someone moving by the accident scene, and we had to move them straight to loot in the night. And we're able to do that, but the whole cost literally was handled by, I think, one of the HMOs. So those are just the little loopholes, right? And also, what is the response of this bystanders, the roadside guys, whenever an accident or an emergency happen? Because the golden hour still applies. What do they do within that golden hour? Whatever you do within the golden hour practically saves lives, right? And thank God that Mr. Pascal's initiative has helped to train people. Although we do train corporate organizations, first aid under ambulance academy, whereby we do the old integrated training, CPR, mannequins, and all of that for them to ensure that these people have the right knowledge to save within that golden hour. Yes.
Right, and you know, we talk about the golden hour and all of that. So in many instances, when when you see disaster or emergency situations like this, what you see is people that are taking pictures of victims, or maybe just doing videos to get attention rather than helping them out of the situation. Not saying that these people don't care about these people, but I think the next thing that comes to people's mind is, oh, bring out your video and say, oh, see what is happening, or what will you attribute this to, and how can I mean, there needs to be surely a way to draw the line, or at least
So
find a
so
balance.
for that, it's education majorly, and it's not about literacy. People are literate. We can't say that people that are at the scene of this event don't have right knowledge, but in terms of education, they don't know, right? So it comes on, the responsibility lies on people themselves to know what to do, and also for government to train people. So in instances whereby we have emergency, before I bring out my phone, next thing I'm first thinking out is this person conscious, is this person unconscious, and next thing I want to do is, can I get a car, or do I need to perform a cardiopulmonary resuscitation, a CPR, right there and there? And the truth is that whenever a CPR is performed, you increase the chance of living by maybe almost 50%, 60% in some cases, depending on the incident, right? The funniest cases is that even when people have fun or go to recreational centers and people slump, it's funny that people don't know what to do, right? So we have to intimate ourselves, educate ourselves. No matter how big you are, there are some life skills that should be made necessary and compulsory for even everybody, right from secondary school, to have these life skills. Not because of you are a medical doctor, or you're a nurse, you're a physiotherapist, or you are in any of those health related courses, right? But a basic need for everybody is to be able to perform a CPR, know what to do whenever someone is having a seizure, know what to do when someone experiences a stroke. Just the basic thing. No, nobody's saying that you should know how to put, like, do an IM injection or administration or all of those things. But the basic thing that you need to do, which is not recording, is the last thing to do. Someone else can do the recording. Then another thing I think I want to mention is that most people don't know the law, right? And in the case of not knowing the law, everybody's trying to be careful that, okay, if I touch this person, fingerprint, blah blah, would they not rope me into the whole case that is an attempted murder, or is more or less like an assassination? People can be funny, right? But I've seen instances whereby our law agencies, our law enforcement agencies just pack people without having the right conversation or the right way to handle things, and all of a sudden you blame yourself. Even I think last 2 years or last 3 years, we had a situation whereby someone took someone to the hospital, and it became a case of they didn't want the person to go because it took someone to the hospital. I just helped out. I should not be saddled with the responsibility of just helping a stranger out. So thank you.
Right. And so, whose role exactly is it to carry out this awareness and public enlightenment? I'll ask you that, Mr. Pascal, because I like what your initiative is doing. But do you also think that the government also needs to play a huge role?
So we recognize that. I'm glad about the stakeholders' role as part of this discourse this morning. We are very mindful of the fact that we need the public sector, the private sector, and the social sector to collaborate. It's a collaborative journey. When we began several years ago, we realized that federal road safety has a critical role, that the lead agency when it comes to road safety. And we signed an MOU with them. I mentioned the MOU. That was intentional, not just only federal road safety. We had National Orthopedic in that program, in the MOU, FMC Butemeta, and the Ministry of Health, Lagos State, committed on behalf of Lagos State health facilities that the first 24 hours an accident happened, when a crash victim is taken to any of those facilities, they should be given, during the, we call it golden hour, they will be given a free stabilization and resuscitation at our expense. Sorry, our organization was originally doing 30,000 per person, but we have increased it to 80,000 non-refundable for every Nigerian critically injured in the course of crash, whether gas explosion, etc. But taking it further to the knowledge he spoke about. So we took a further step. You asked who has a role to play. One of the areas Nigerians have fears is the police. So we made the commissioner of police and his team, and he sent them, we trained them as TOTs, and they also now came up with the idea that police will not harass anyone that is saving lives. And we don't just only train, we certify. So we certify with federal road safety, and even give reflective jacket that has government logo, road safety, and Lagos State Safety Commission logo for those trained, so that asserts or offers you some legitimacy when you are in the public space trying to save lives. But the most institutional approach we took recently was to secure the approval of the Honorable Commissioner of Education, Lagos State, to integrate this program in the curriculum of secondary schools. To date, we train thousands, over 2,000 teachers and secondary schools and students in secondary schools. But the way you have physical and health education offers at the course in the syllabus of schools, we'll secure that approval. We are on a journey now to have every district in Lagos State, both including federal institutions, offer this program as a course in secondary school. GS3, SS1, SS2. The goal is that we have a young people who have capacity to offer pre-hospital emergency support in Nigeria. As we did in Lagos, Kwara State also recently approved. We also will be in Rivers State. The Minister of Education is giving similar approval. So it will be a pan-Nigeria initiative ultimately. So people will no longer, because we have few doctors. Even if you have doctors everywhere, there are some things the golden hour does when it comes to applying CPR and first aid. It does not give you the leisure of more than 10 or 20 minutes. So if you do not offer the CPR as at that within that time frame, there is a likelihood that you lose your loved one. And we have seen young people, secondary school students we trained, going even in their school, they have handled emergencies. At home, some of them have extended this skill even for their grandparents and relatives. So it's a skill, like he said, that everyone needs to have. And we've also extended to even religious bodies. Some of them, corporate bodies, religious bodies, we have capacity in-house to make sure everyone who is seeking this skill will have it, because you don't know who you may be able to save.
Right. Right. And Dr. Adelu, it's very interesting that many public and private offices, safety and emergency response equipment are lacking, like, talking about firefighter equipment and all of that. I don't want to say if it's a case of faith or just maybe people not having, or organizations not having maybe the resource to purchase this equipment. But what can actually be done about this?
So, what can be done? First and foremost, I think Lagos State is trying a lot with their Safety Health Commission, the Health Safety Commission, because before you even go for some event or outdoor event, they ensure that you have at least an ambulance on site. But some of the things that can be done, right? I saw a defibrillator on the streets of, I think, UK or US, and this is not to sound cliche, but as important as that sounds, there are some facilities, right? Now I'm not speaking in terms of state or location, but there are some facilities that don't even have a defibrillator. And a defibrillator now, if you are looking at maybe the market price, it should be around like 1 million, that range, estimation of 1 million, give or take, right? And this is not something that is easy to come by looking at our current economic realities, right? So it is one thing that the government can do if they want to supply. The other thing will be, what is the assurance that this will not be stolen if they are installed at some public places, whereby people can easily just access whenever there's a case, and you use things like that. Now for the other, like fire emergencies, fire extinguishers, I know that road safety FRS is doing a good job with ensuring that each car has its own fire extinguisher. So to an extent, I think everybody is getting enlightened with that, and we're doing a good job. But in terms of the defibrillators, it's still scarce. I don't think most hospitals maybe have one or two, defibrillators. I don't know about the private hospitals, right? So I can't speak about that, about number of defibrillators they have. But we can ensure that we have these defibrillators located at different sites. For us now, we have almost five. We have almost five, one in each of our ambulances whenever we want to dispatch, one in every time we go and cover adult games, because we run a sports medicine of the company whereby we cover games, island, mainland, across Abuja, anywhere majorly, and we ensure that there's a defibrillator, because sad story, we have seen cases whereby people just go down and practically there's nothing you can do. They just slump at fields and people are wondering, oh, let's pour water, let's pour water, and that's how they go, because there's no defibrillator. So even if venues, event centers, churches can have a defibrillator, install the keep the defibrillator whenever there's a need, right? You bring out your defibrillator and use it, right? You get a new part for it and you move on, right? And so for me, I just feel that everybody just needs to be more conscious and be more proactive, and we should not leave health to a thing of chance. Emergencies never announce whenever they want to happen. That's why they are called emergencies, right? So that's just my take.
Let me ask a final question to both of you just before we go. It's very brief. Finally, what regulations can be put in place? Especially, you see events, you probably see crusades, and there's no ambulance, there's no first aid on the ground. Like, things can happen. You see events where you have loads of people and there's no medical, no medical body even present. Like, you now see something happens and they're like, please, is there any medical doctor here? Is there any? What regulations can be put in place? Because there surely should be something of such sort, that you can't have an event where you're bringing people together and you don't even have any form of like an ambulance or like medical aid on ground.
So the Lagos State Safety Commission, you remember during the rice palliative last December, where some people died in some locations. So Lagos State also took some steps to reinforce compliance. What they have done is great in terms of, before you conduct this, obtain permission. But enforcement is critical, and enforcement may not happen only with do we have enough trained responders? Because again, it's not everywhere you are able to have doctors and deploy them. But if you have emergency responders, first responders, even in the developed world, one of the critical things that you see in every nook and cranny is, this happened, first responders were there. The paramedics, together with those who offer advanced care, their number may not be up to 5% of the emergency responders. And that's why one of our goals is democratizing emergency response. We partnered with LFR International based in Michigan. They came here. They've done this in 9 countries. We targeted those at the community level to train them on this skill. And we took a step again related to this, is that with community health extension workers in the various Lagos health districts, we not only equip them with this skill, but also non-communicable diseases. So they now go to the people they call community gatekeepers, informants. So those people spread across nooks and cranny, having the capacity to offer some help, even if it's to call 767 so that the paramedics arrive on time. That's a huge one. So in terms of regulation, Lagos State Safety Commission for Lagos, and of course when we are talking about federal road safety, should collaborate more with stakeholders and entities that are involved in this. But I also want to put it to the corporate bodies. All these persons, these groups or segments we trained, 80% of them were sponsored by corporate organizations. Only few organizations can afford AED, the defibrillators. Recently is about 1.4 million. So you can even if you find it, people will steal it. But when you have multiple number of thousands of people who have basic knowledge, they will fill the gap that the absence of AED would not may provide. So they will fill in that gap where there's no AED. But there must be more handshake between the regulators, safety commission, and those who are in the field on ground, to ensure that we can save more lives. We need to, the ultimate goal is the life of every Nigerian must count. And COVID has taught us that if we do not invest in the health sector, it will come back to haunt not just the government, but also the corporate space. So let's all pay attention to this. Pre-hospital emergency is critical. We need to democratize it.
Absolutely.
So talking about regulation, thank you so much. 5 years experience working in this field of pre-hospital care, air evacuation, land, sea, and all of that. I think what we need to do is that I think all states needs to imbibe what the step Lagos have taken when it comes to events. I'm so happy that churches are taking, religious organizations are taking good steps. The experience, you see ambulances, for some other big crusade, you see a tent and maybe ambulances, at least one or two, right? Even though that might, if you go into details of what is enough, that might not be enough. So because we do like a ratio of ambulance to a ratio of people attending, but at least they even have something on ground to respond. That's a good one. I remember we covered one of Kenny Black's festival at Onikon, and we had to deploy like almost 4 ambulances, 3 to 4 ambulances, and over the course of the show, which was a good one, because if you are going to have large number, over 500, over 1,000, right, you don't have their medical records. These people will not announce to you that, oh, I'm a sick cloud, I just want to come and have fun and die at your event. So you need to be prepared that, okay, in cases whereby it goes other south. Now, he has mentioned and he has established a whole lot of things. I don't want to repeat what he's saying. But another aspect that I know that we didn't talk about during this whole period is mental health response. There's also a first aid for mental health response. Because with Nguvu Health, I remember that we had cases whereby when I was working with Nguvu Health, we had cases whereby at 2 a.m., 1 a.m., we are getting responses that someone's committed suicide, someone is psychotic, and we had to do collaboration with Ambulance Nigeria, Citronel, to now do a case of let's establish this and let's see if we can rescue, because most people don't even know how to handle mental health emergencies. When people have mental health breakdown, I had one of my very good friends that had an episode whereby immediately I saw the chat on X, I knew that she was going through crisis, because when someone starts talking over time, you might not know if you are not trained to see it. So people kept engaging with the person, and in my head I was like, you people can't see that there's something wrong with these conversations. So immediately I saw it, I had to like call and say, okay, is anybody close to the person, or does anybody know about the whereabouts? So there's another aspect of mental health response that is different from CPR, different from, oh, there's a cut, let's seal up a cut. Because there's just a timeline where there's self-harm and there's suicidal thoughts, right? And if you go by the Lunacy Act and all of those things, there's still the stigma, and most people want to come out to own up to it. So there's another aspect of where training for mental health, how to handle mental health cases, where people are psychotic and all of that has to come into the picture. And I just hope that we the private sector, in collaboration with the public sector, can come on at the round table to discuss more and effect these measures and solutions that we have talked about, and in order to save, like to have a more healthy and a safer populace. Yes. So.
Thank you very much, Dr. Emmanuel, as well as you, Mr. Pascal Achunine, for your time on the morning show this morning. It was really insightful speaking to you, and I do hope that the conversations we have here this morning will definitely make a great impact that would lead to change, especially in Nigeria. But thank you very much for your time, and enjoy the rest of your day.
Thank you for having me. Thank you, viewers.
Hello and welcome to the Big Story segment. We're still talking health emergency responses and disaster management here on the Big Story. And I've got here in the studio with me Dr. Abigail Imperidem Hassan. She's a CPR and first aid instructor, and she'll be talking us through, the CPR processes and what to do when in a health and an emergency situation. Welcome to the show, Dr. Abigail.
Thank you for having me.
Firstly, let me start by asking you, we've established some of the situations that do occur that we would term as health and safety emergencies and all of that. But you are a CPR and first aid instructor. Let me start by asking you, what exactly does CPR mean, and what can we categorize as first aid in an emergency situation, health emergency situation?
Technically, CPR means cardiopulmonary resuscitation, but I wouldn't be asking someone that is not medically inclined to start knowing what is CPR or cardiopulmonary resuscitation. What I would just want the person to understand that CPR means is cardio is simply your heart, pulmonary your lungs, resuscitation make alive. So this is a combination of you trying to restart the heart. And for you to say you are restarting something, it means the thing works normally, but it has stopped working. So you are now taking on the responsibility of restarting it. Now that means that no matter the first aid you are giving, if the heart has not stopped, CPR is not considered. We have several cases of emergencies, and CPR is not the first option until a case of sudden cardiac arrest, which simply means the heart has stopped working. That is when CPR is allowed. It means the person must not be breathing, the person must not have a pulse, and the person must not be conscious. If any of these three is available in a human, abort CPR. CPR is not allowed. So that's technically what CPR means. In other words, every emergency might require CPR, but not every emergency should get CPR. What do I mean? In a case of fire or choking or seizure, the person is still breathing, the person has a pulse, the person can be conscious. You assess the situation to be sure. Although all this emergency could lead to someone having cardiac arrest, the heart stopping. So you always have to be prepared. When you are attending to any emergency, you just have to be prepared that I might have to give CPR. So you have to be ready. So the basic and the first thing to do in every emergency is to call for help, because CPR is exhausting. Honestly, I've had to perform few, and it's really exhausting.
For the person conducting the CPR, or the person getting it?
No, the person getting it is banking on you. The person has no idea what is happening. However, the you conducting it, you feel the exhaustion. But what does it mean? It means being able to give the person a fair chance to live, irrespective of the person's tribe, religion, race, anything. We are all humans, and safety is should be everyone's concern, actually, because not responding is actually a response. If you see an emergency and you don't respond, you've actually given a response in itself. So CPR is exhausting, and you might have to give CPR more than the regular 5 minutes, 10 minutes. You might be very lucky, in other words, where you have to give CPR till you get to the hospital. And it could span from 30 minutes, 40 minutes to hours.
That's really exhausting.
Yes. And if you're not a medical doctor, you're not allowed to declare anyone dead. So it means until you get a medical certification that says, oh, this person is dead, you keep doing your best. First aid is simply saying, it's like someone that is driving on a fast lane and the brake fails. And you step in to tell the person, I know you're going on a fast lane, but I won't let you crash that way. So that is just what being a first responder means. You're not guaranteeing that this person would come back alive, but you're just trying to say, I'm not going to give up on you. I'm going to give you a chance to being alive. And I'm going to do that sincerely. So yes, CPR can be exhausting.
Wow, this has been very enlightening. So you did mention this fire response and all of that. Dr. Abigail, if you could just help us this morning to, name the different health emergencies that could occur at any time and the actual correct responses that should be given in terms of first aid.
Okay. So I know the timing is short, but one of the things we do at Health Emergency Initiative is we take through a process of trainings on the different kinds of emergencies, and this can span between 3 to 6 hours for you to get, but I'm going to try to keep it very brief. So emergency and disaster management are actually in sync. What does it simply mean is how to manage contingencies when it happens. And like I said, giving CPR does not guarantee that the person would be alive, right? But it simply means I would give a fair chance. In the case of a fire accident, for instance, most persons would want to pour a lot of things on the person's body. However, even in their palm or hand, it's just let the person run on running water, clean running water, and then take the person to the hospital. Because as a first responder, the basic things you need to attend to such, you don't have it.
So all those things like pour salt, I don't know.
No, they are wrong.
Okay.
It's just clean running water, because by the time you get to the hospital, all those things you put, the medical doctors will now have to start removing them first before attending to the person. And don't forget, we talk about golden hour. Most of the persons that died did not die because they should have died, but because of the time in between. So when they are just supposed to be attending to the person, they have to now be removing all those things from the person, and sometimes they could leave a scar. And in the case of seizure, you see epilepsy, you see persons putting spoon, saying you should not clench the teeth, pouring oil and the rest. This is someone that can't even breathe, and you're pouring things. It might actually, no, not might, it will obstruct the airflow. For that kind of a person, just make sure that there is nothing that can harm them around. Keep the place clean. Make the place safe for them. If you can put a soft pillow or something under their head so they don't bang it, it's fine. But when they are done, you put them in a recovery position. And that brings me to, we have 5 cycles actually in emergency or disaster management. Following them can actually guarantee safety. One is prevention. For instance, phone call might not cause a gas explosion, but it can cause distraction. So how do you prevent a fire explosion when you are in the kitchen? Is keep your phone away so you don't get distracted and forget that, oh, I actually have something on fire. Now that's for prevention. Now mitigation. Mitigation is, now if it has happened, how do I mitigate loss of life? Now that comes in line with preparedness. And that's why we talk about persons being trained. And when we mean being trained, the cliche is, oh, he's a medical doctor. I'm not a medical doctor. I hold a PhD. I'm not a medical doctor, but I've seen my dad. I watched my dad die from sudden cardiac arrest. And I understand what it means for laymen to actually be there for persons. I've lost medical doctors as friends because the persons around could not know the basic thing to do. So even medical doctors deserve a chance to being safe because they also encounter emergency. Emergency do not segregate based on profession or your class. It can happen to anybody, and everybody should know what to do when emergency happens to anybody.
All right. I like all of the things that you've said. They've been very enlightening. So can you tell us some of the misconceptions about first aid that people have? So we just cleared this doubt once and for all.
Okay, the first thing is persons think once you hear first aid is a medical thing. You have to be in the medical profession, the medical field, and before you can do it. First aid is not. First aid is actually for the actual witness. It's either you're there at the scene of an emergency or you are easy to assess the scene. So a medical doctor most times deal with in-hospital emergencies. You are out. So we have in hospital and out of hospital. You are out. So first aid is the first thing you do when an emergency occurs. The second myth, and humorously, is we think health is just about money. So in the prevention aspect of the cycle, it looks at other things you can do within your environment as a person that could help prevent an emergency from happening before it gets to that point. So yes, you need money when it happens and also to curtail. However, you need personal lifestyle changes also that can help. And another myth would be that, oh well, it's not happening to me. As long as it's not happening to me, I'm fine. No, emergency is everybody's concern. Therefore, safety should be everybody's concern. The government, the private individual, the corporate, you as a citizen, as a person. By the time you're responsible for your neighbor, it's building a cycle, a chain where I'm an effective bystander. When I see my neighbor, I should know, oh, this person needs to go to the hospital, or what can I do for you? Can I help you? As basic as it sounds, is the first emergency question to always ask people. Can I help you? Because the honest truth is, yes, CPR is not in every situation because situations might not warrant it. But when it's needed, you will need someone to help you when you are exhausted. So if you're able to build and train others on how to conduct it, of course, it becomes lighter. And if we have AED, fine. AED is automated external defibrillator. And it's not common, actually. AED alone cannot restart a heart. Hands only can restart a heart. And that is why CPR training, the compression aspect of it, is actually very important. If you have AED alone, AED just analyzes the rhythm of the heart and tells you when to start compression, deliver shock. Even AED acknowledges the fact that compression is very key, because compression will tell you, will allow the heart to pump in and decompress. Then AED just helps support, helps you to analyze it. So if we're going to wait until we have AED, we might actually waste someone's life. However, if we can do effective CPR, now there's CPR, then there's effective CPR. There's effective CPR that once you do it, the person stands a fair chance of standing back up.
And so finally, you talked about us being responsible and responsibility and all of that. I'm not sure it's everyone that knows how to carry out a CPR. But just for everyone who would watch, everyone who's present in the studio, everyone who needs to learn, what are some basic, is it first aid, will I call it first aid skills, or first, maybe let me just use the term first aid skill that everyone needs to learn, so at least we can take that away today.
Okay, like I mentioned, first aid, like the word says, first aid, first, immediate care that you give. So the first thing you want to know is, for instance, I'm big on keeping a scene safe. So in first aid, we have something called Dr. ABC. D is for danger, R is for response. Those two, they are stagnant. So you have to ensure that you make sure that your scene is safe. And now when I say scene is safe, it's not just in the presence of emergency. If I'm walking down the stairs in my workspace and I see, let's say someone ate and dropped either a can or a banana peel, or wires are running through, as a responsible person, I should arrange or pick it up, actually, because someone else can sleep. I might see it, but if the light is off, someone else might not see it, and then the person sleeps and it turns into a casualty. So yes, check for danger. You assess if someone is responsive, and you do that by asking, can I help you? And then you check for the airways, and it's simply tilting the head to see if the person is breathing. You can actually check for the pulse. You can check for the pulse. If you're not very sure, you can look at the rise and fall of the chest, because if you are doing CPR, it simply means the person's heart has stopped. And if the person's heart has not stopped and you do CPR, you know what's going to happen. You're going to now stop the heart. And then you check for breathing the same way, and then circulation. But if it's for CPR, is Dr. CAB, that is compression first, airway, then breathing. But in doing all that, the basic, I believe everyone should know and get familiar with is be trained, be emergency prepared. Might not be for yourself, but be emergency response prepared. As a good person, just be prepared.
On that note, be prepared. Thank you very much, Dr. Abigail, for your time on the big story this morning. It's been a delight speaking to you. Very knowledgeable. Thank you so much. And that's how we bring it to wraps here on the big story. My name is Elizabeth Musa. Keep watching.